Hi Miss, my name is Shunday Eugenio, your future nurse star. Today I will be sharing something very important in nursing care. Tracheostomy care. So in this video, we'll learn what tracheostomy is, the equipment used, the proper procedure, and how we care of the patient with tracheostomy. So sit back, relax, and let's make learning more fun and easy nursing style. What is tracheostomy? Hi Miss, today I will talk about the tracheostomy care. Tracheostomy, it is a small opening made in the neck that connects directly to the windpipe or trachea. So a tube is placed in that opening to help the person to breathe normally through their nose and mouth. So it's usually done for patients who have breathing problems or throat blockage. So now, we have the 5 equipment and their purposes. In doing tracheostomy care, so we need equipment. So first, we have sterile gloves to keep both the nurse and the patients safe from germs. Second, we have suction machine to remove the mucus or secretion that blocks the airway. Third, we have saline solution to clean the opening and soften the dried mucus. Fourth, we have tip applicator to gently clean around the tracheostomy area. Fifth, we have tracheostomy dressing and ties to cover and protect the opening to keep the tube secure. So let's proceed about what are the sickness or disease that are need tracheostomy. So, the tracheostomy is needed for patients who have trouble of breathing because of a certain sickness like throat cancer, which blocks the airway. And we have also chronic lung disease such as COPD. And neck or head injuries that damage the airway. Stroke, which affect the breathing muscles. Siyempre. Or severe infection or swelling in the throat and blocks the airflow. Next. What is the procedure? Here's why the tracheostomy care is done by step. First, wash your hands to prepare the all equipments. Siyempre naman, to remove the bacteria and prevent the spread of microorganisms. Second, we have explained the procedure to the patient to keep them calm, sa atong RD. And then, wear sterile gloves and protective gear. Fourth, we have all dressing to check the area for infection. So, 5, we have clean the area with saline cotton applicator to remove the mucus and dirt. 6, we have suction and mucus if needed to help the patient to breathe better. And 7, we have put a new clean dressing and secure the tube in place. 8, we have observed the patient breathing and comfort. And last, we have recorded documents of what you did. Care. So the purpose of tracheostomy care is to siyempre, help the patient to breathe easily, keep the airway clean and open, prevent infection and blockage, and promote comfort and safety, and monitor for any complication as early. So here's the medication, normal saline solution. So the purpose of this is to keep the tracheostomy tube and airway moist and help moisten the thick mucus and is used for cleaning the stomach area. Second, antibiotics like amoxicillin, cefuroximine, and the purpose of this to prevent or treat the infections around the tracheostomy site or in the lungs like pneumonia. And third, we have bronchodilators. Bronchodilators is the purpose of this to open the airways to make the breathing easier, and especially for patients with asthma or chronic or COPD. And fourth, we have mucolytics. Mucolytics like acetylcysteine, and the purpose of this is to clean the thick mucus so it is easier to suction